Hi everyone, it's Miss Celeste here. I'm your professor for ECE 603. We are getting into week 3, part 6. Part 9 of 12. We are moving along fast here. Tonight, before we get started, I'm just going to review our assignments for week 3, making sure you're doing the discussion, which is due Wednesday. Replies are due Saturday, but please make sure that you're doing them on separate days. That's important. And then the assignment, which is due Sunday of week 3, and then of course the quiz that we have posted as well. So all this information is in Canvas, so just make sure that you go over to Canvas and you read a little bit more about the details of each of these assignments. So you can be well prepared. Okay, and if you have other questions, just reach out and I'll be happy to support you any way I can. All right, so tonight we are going to talk about non-life-threatening conditions and what that looks like, the ability to apply health and safety education, identify nutritional guidelines overall, and the ability to meet the needs of growth and brain development, but specifically in infants. So I'm going to talk a little bit about from the beginning where it starts. So let's get started. So non-life-threatening conditions. So what does that consist of when someone says that? Well, I have a set of 11 examples of what a non-life-threatening condition kind of looks like. Of course, these are all scary, right? Because we don't know what is going to happen, right? At first, we don't really know the extent of the injury at times, or sometimes, depending on what it is, what to go and do next, right? So the majority of children, though, children's injuries and illnesses are not, life-threatening, but may require first aid. So teachers who have received proper training, such as doing a CPR and first aid class, which I believe all teachers are supposed to keep that up, I believe every 2 years. So just make sure that that is up to date with you currently. But it is something that teachers do need to do, along with administrators or anybody in childcare that are around children. Initial first aid treatment of children's injuries is important for reducing complications and making children feel comfortable until their family arrives, right? So it's important that we remain calm. We better understand what's happening. Did a child get, bit by something? Did they get burned? Do they have some type of eye injury? What made their nose bleed? Like, what happened? And then, of course, we need to contact parents to make sure, depending on what the injury is, to make sure that they are aware of what is happening. Parents are very sensitive to injuries, as we all are, right? So making sure that you're communicating that effectively is ultimately the number one goal. And of course, making sure the child's okay, which is first and foremost, and making sure that you have, the first aid kit or supplies needed to make sure that you're supporting and helping that child through that injury. So I can't encourage you enough to make sure that you are checking your first aid kits, making sure that you have all the essentials to help a non-life-threatening condition. But back to some of the life-threatening conditions, we have bites. So that could be different types of bites, right? I remember being outside with children when I was teaching, and some of them would get bit by a bee. That was, I guess, the most common thing I can think of right now that has happened, as in a bite at school. But bites can obviously happen outside of school, right? So like dog bites or other animals for that matter, depending on what they have. So just making sure that you have gloves and making sure that you are using those as well when you're treating any type of an injury or helping any child, just to make sure that we're being as sterile and clean as possible. Others are like blisters or bruises, of course. But just understanding, what's happening and how that happened, um, is ultimately most important. Blisters obviously can be uncomfortable, so children may need to be sent home depending on where it is, or could be on their foot or from a shoe or whatever. Depending on that. Burns, of course, are always in different stages. So we have first degree, which is the surface skin, where it's red and some pain and swelling. And then we have second degree, which is red but blistering with swelling and severe pain. Then we have third degree burns, which is a deep skin and tissue. It also may be like brown or white. It may, discolor. But ultimately, pain happens through all of them. And I think they all require emergency medical attention, and kind of leaving that up to the parents, depending on what degree it may be. But again, you're not a doctor, so you wouldn't really know that. So I would be automatically call a parent, so they can determine what they want to do next. But of course, you would notice if it's a third degree burn, because again, you would see discoloration, blisters, and you would know a deep burn from not a deep burn, right? So some cases may require you calling 911, but that's kind of a case by case situation, along with all of these. It just kind of depends on the scenario, the situation, the degree of the injury, and so forth. I've seen many injuries over the course of me teaching, and I was in a situation where I felt a child had an allergic reaction, and I felt it was a 911 type call, just because his throat was swelling up, and of course I think of breathing and oxygen and the brain and all of that. And so they came, and they also told me not to administer the EpiPen, which I thought was surprising in the scenario and the situation, and the severity of the allergy. But thankfully, we had a building pretty much next to a hospital, so the response was probably 2 minutes. So fairly quickly. So that's probably why they didn't have me do that just yet, administer the EpiPen. But on that note, please make sure that you know what children have allergies, what children have EpiPens, where they're located, how to administer them. And a lot of EpiPens actually come with a training EpiPen, which I thought was amazing, because I actually utilized that to train, in addition to getting separate training, and just practicing the use of an EpiPen. It was just so amazing that they actually come with a training one, so you can actually learn how to use it in a situation like that. But back to my story, I did call them, but the parents actually argued the fact that it wasn't an emergency to that extent. So unfortunately, we didn't agree. But at the end of the day, if I feel that anything is harming a child, or especially when I see a throat swelling and I'm thinking of oxygen and breathing, I'm going to call 911. And so what I encourage you to do in situations that you feel are life-threatening, or you are unsure, the best bet is to always call for help. Because of course, if you didn't call for help and something, happens, that would be something very, very sad and not okay. So again, I would go back to calling 911 and getting the support that I needed at that time. And I actually would not do it any other way, despite the parents not agreeing on kind of handling it that way. So, of course, you may get situations like that. I hope you don't. But ultimately, we have to make sure that children are safe in our environment and when they're with us at all times. And if something is unsafe or something is, of course, life threatening, and you feel it is, I always say ask for help. Okay, so just note to self. Next is the ability to apply health and safety education. This is a big one for me because I really feel that we need to apply parent education options for parents to participate and learn. I think this is something that we have to do all through the year consistently. This is something that I want teachers to advocate for and host. I know it's a big job. I know it's probably something different that maybe you've never done. Um, I'm also happy to support you and kind of how to navigate that if you needed. Because I think the more information that we give parents and even teachers, the more that you're going to be well prepared in many situations. To also teach within your classroom. I found this diagram here. This is obviously for older children, so grades 3 to 5, 6 to 8, and 9 to 12. But these are ways that they incorporated health and safety education within their curriculum. Obviously, if we're talking about preschool, we're not going to get into details such as this, but we may make it a topic or a conversation or a lesson within our day-to-day or circle time or classroom, right? But I definitely liked that they supported ideas such as identifying health-related situations that might require a thoughtful decision and kind of challenging them to think of what they can do in that situation. Another is choose a healthy option when making a decision. So what are healthy options to you? What does that look like? What are those choices? Another is choosing healthy alternatives over unhealthy alternatives when making a decision. So making sure that we have alternatives overall and children have those, to make those choices. Because we can't assume that every, child, again, depending on, I feel like I've talked about this before, the age that they should just know. We are here to support them. We are here to guide them, help them, kind of go through the process with them if they allow, and be their mentor, so never assume that children know just based on their age, but find out. And by finding out is going to give you the information that you need as teachers, and then will help you relay a new lesson or teach a new area, maybe in a little bit more detail, depending on what it is. And that's where you get your information most of the time, or what I encourage you to do, because we have to model, healthy choices and opportunities to make decisions, based on how we're trying to guide them. And so when they see us making healthy choices or going through the help, having us go through the process with them, there's so much learning that's happening. So please never assume, although they are older, kids, they all come through different environments. They all could go through different experiences. So we cannot assume that ever. Okay. So make these lessons part of your classroom, make them a conversation, but not only in your classroom, but again, back to parents, providing opportunities for them to learn and participate as well is ultimately going to help all environments. All right, nutritional guidelines. So of course, the CDC has nutritional guidelines. There's so many resources for parents to understand, healthier choices or options, for their child. But ultimately, parents are going to choose what, they see fit, or, but we also have to understand, depending on the financial means, some choices are made based on that at times. And so we have to be sensitive to that, and we have to give them choices or suggestions, and being mindful that everybody's situations are very different. And so we just can't assume they're choosing not this food over that food. But ultimately, maybe they just can't provide that food for whatever reason. So I encourage you to have more conversations about what a healthy option is for them, talking about what fruits and vegetables are, grains, protein foods, dairy options, and then also providing plenty of these options within your classroom for them to have. Another area of nutritional guidelines is that physical activity. So as much as we talk so much about food, we also have to provide them opportunities to burn calories and get their energy out and do a lot of physical activity. I also would encourage lunch suggestions. I used to have a recipe book. It was just for lunches. So it gave ideas for parents, to pick ideas out of. It was just something there that I had created over the course of, many years, and having the question of what do I provide my child, with, because they don't want to eat anything or whatever the case may be. So I then was like, oh, maybe I should create a little recipe book. And so it just kind of grew and grew and grew. And so I encourage you to maybe do something to that effect, or keep a journal, or just because even parents will share ideas. So it wasn't just my ideas, it was a combination of their ideas and even understanding the outcomes. So I would ask them, oh, how did it go? What was the process? Did they have fun? Because I also have ideas that incorporate the children to participate as well, because I think that is also ultimately very much important, especially when they're packing their lunch, choosing their foods. We want to practice choosing healthy options, but in order to do that, we have to give them opportunity to choose those healthy options. And so it was just really fun. So I encourage you to really post and talk about nutritional guidelines, what that looks like, have lessons and activities in your classroom that promotes these guidelines, give parents some suggestions or opportunities to share their ideas, because I think that's so needed and so fun for them to be included in that conversation, because so many parents have so many great ideas. And next is supporting the needs for growth and brain development in infants. So ultimately, we have to better understand how the brain grows, where it starts, right? So from 0 to 1, 60% of the infant's energy and brain growth is happening. And so it's important that we provide them with a good balance, right? Like I always say, of supporting those developmental needs that they're going through, developmental milestones specifically, giving them opportunities to experience different learning opportunities, putting them in environments where their brain can be stimulated, where they can exercise and touch and sensory components, to their learning. Because as they're growing, they are, definitely supporting and laying that foundation for later learning. So if a child is not, had a good foundation, that's when later in life we have some areas that may be a bit challenging at times. So laying that foundation is critical when it comes to brain development, and definitely, creating and connecting and, those rapid growth within those connections that are happening within the brain. So that's why you might see, parents will sometimes choose vitamin supplements or DHA, omega-3 options, or foods that have it in it. These are, critical building blocks to the brain development. So there's always reasons to why certain vitamins are beneficial for children and why they're needed. Because good nutrition, good hydration, a good balance emotionally, is something that has to be established, around any child for that matter. But as they're growing into their toddler years, they are getting to know more about themselves. They're exercising their challenges, right? They're exercising their choices. They're wanting to make more choices, right? And problem solve. And but we also have to understand that 100 trillion brain cells are just igniting, and they are even connecting even more. And so managing the learning potential is ultimately what we always want to support. So that then goes to making sure the stress management is maintained and supported. It's important, to a baby's developing brain that the amount of stress within the home is minimal, because the stress, does not obviously help the brain, and it also, will make the brain a bit stressed, and it also will not allow for those connections, to create healthy balances. We also have to think about the sensory experiences. So babies love to taste and touch. It's another way that they learn about the world. And then, of course, engaging in play, big component here. Babies love nothing better than looking into a loving caregiver's face, right? Feeling loved, accepted, cared about, making eye contact with their child, making funny faces and smiling and playing games. Really gives the baby the bright, colorful objects, to look at, and really gives them practice in that engagement and what that feels like, right? So there's so many situations, as we get older, children grow, that why I'm a big advocate for going through the process, and how much experiences matter on how they learn and grow, have perspectives and outlooks, on certain areas. So those influences matter. Those lay the foundation. And so as an infant teacher or toddler teacher, it's important that you understand the process of brain development so you can express that to parents, so they can make great choices in nutrition, social emotional support, language and literacy support, cognitive support, just all of those areas. Because as much as you are supporting those areas in the classroom, they have to be balanced at home as well. So encourage parents to be engaged in those moments, create opportunities for them to learn, such as going back to my idea of parent education night, because that ultimately is going to bring in a community aspect. So together, you guys all can benefit the whole child. And that's ultimately what we want to do. In summary, just making sure that we are well prepared to handle non-threatening conditions, but also prepared to handle threatening conditions, as I shared my story about the allergy and the child, and also making decisions based on the situation that you're in, because nobody else is in it but you and the children or the child, and can really make that call. So just be very aware of that. Another area is the ability to apply health and safety education, utilizing your position to share helpful information to parents consistently is a goal that I want all of us to have and to continue to work on. And then the identifying nutritional guidelines overall. So making them present within your classroom, outside your classroom, supporting parents in these guidelines by providing resources for them, ideas for them, so they can make sure that they are being mindful of those guidelines. And then the ability to meet the needs of growth and development, brain development in infants. And so just understanding where it begins, because understanding where it begins will help you understand the process. And that's what we want to continue to convey to parents when we're educating either new educators, new teachers, supporting parent education, etc. So it's important that you understand where it starts, and I encourage you to take some more classes specifically for infant and toddler, because that is a specific area. And so depending on what environment you're in now, I encourage you just to continue your professional development, because more ideas are coming. There's so much learning that is continuing to develop and happen. But thank you so much for being here tonight into my webinar. I hope it's been insightful, and I appreciate you. I will see you next time, and that will be our last video. And so we are almost towards the end, so congratulations, but I will see you in our next video. Reach out if you have any questions. Thank you so much. Bye-bye.